Hi, I'm Betsy Rust, Plant Moran's Healthcare Strategy and Operations Practice Leader. Welcome to the Bottom Line video series. This month we sat down with Mina Breuker, CEO of Holland Home, and Teresa Toland, CEO of Tandem 365. You'll want to hear how they are significantly improving the end-of-life experience for their patients while drastically reducing cost. This is something everyone that serves seniors will want to hear.
What Tandem has set itself up to be through all of this is a solution to physicians, health systems, you, your mother, your father, whatever, a solution that figures out what's needed.
It's not just a nurse, a social worker. It's a nurse, it's a social worker, it's a physician, it's a volunteer, it's a paramedic, it's the family. It's everything wrapped around that makes a difference. There are 5 partners, and 4 of them are senior living providers. So it's Clark Retirement, Porter Hills, Holland Home, Sunset Retirement, and then Life EMS. A very unique combination when you think 4 of us are competitors.
How Tandem got started too really was because we're all involved with the health system, Mercy Health at the time. And Mercy was having a really hard problem, and the hospitals were going to be penalized on readmissions. And we each of our organizations at that time received people into the skilled nursing area, and we were transferring people back and forth. It was really about transitions of care and how can we stop this problem. And we're the experts. We know how to take care of seniors. None of us were really good at probably not sending them back in the hospital every time someone had a fever or a cough or whatever. And so the hospital system said, I can't work with all of you individual. That's not where the solution will be. The solution will be that we all come together in one room and we talk about what are some of the things that, are not working well in the health system and the health centers that we take care of our people. What are we not doing well, and how can we turn that around to something that we do right? So far this year, we're at a daily census of about 428. I would say by the time that we get to the year end, hopefully we see well over 500.
So measuring success of Tandem 365 is multiple ways. One is reducing rehospitalization rate. And so what we found working together and developing policies and procedures and systems that we all followed, we could decrease the rehospitalization rate as a whole. We were at 23% going in and got it down to 4%. And that's because we had systems we worked on improving.
You're in the hospital 3.6 days, and that's it, and you're out. That's an average. So once I'm out, I'm in one of these post-acute provider arenas, right? So we have to get good at what we're doing. Now it matters, because otherwise we're going to end up right back in the health system, the acute care setting. And that's why what we do is so important. We don't choose to separate ourselves and be siloed with just specific players in the community or health systems. When we work with Priority Health, which has been a very great partner in this journey, they take care of people in all the health systems. So we have to figure out how to make that work. And there's strengths and opportunities within each of them, and they each ask for different things. And I think what makes us unique is our ability, which we've shown from the very beginning, day one, our flexibility, our nimbleness, our ability to think openly. All of those things are how we've gotten to where we are. The value today, and I believe the value in the future, is absolutely reducing the cost of someone who's spending $100,000 or more a year on healthcare. And why? Because they don't know a better solution than to go to the emergency room, and they don't know how to manage their health. They really don't. And so our goal is to help them manage that. Be a navigator, hold their story with their physician, hold their story when they go to the ER, connecting some of those dots where there were gaps before. We connect a lot of dots for people. Currently today, we get paid in a per member per month payment methodology, and that's based on just what we have considered to be our cost of caring for that individual at this point in time. Those are constant conversations, of course, because healthcare always wants you to do things right for less money. What we've done on our end and what I think we're really good at is we've really even bring our case managers in to say, what does it really cost to take care of Mr. Smith? Let's really look at that. What services does he really need? Because they're very generous and they want to take care of everybody, right? More importantly, above and beyond. But we look at what's really needed, and our goal is to continually drive down the cost, because we know we'll have to, but still have great outcomes. And we do have great outcomes, by the way. Out of 428 people that we're serving today, we had 17 go to the emergency department in a month. That's pretty amazing.
Especially when most of those people are either at the end of life or very complex medical cases. And how do you manage that?
The model of reimbursement, I believe over time, and perhaps with our next partner, because we have a few discussions that are occurring with Blue Care Network. And I think that what we'll see is that it'll be more of a risk and a cost sharing savings. So if it costs $100,000 to take care of Mr. Smith and we can do it for $60,000, then they've saved 40%, right?
And another model that we're looking at to extend is a private pay. So for families who could pay for this themselves, and maybe the children are out of state and they're concerned about mom or dad, to have those care and services and someone to help manage. So that's another model that we're looking at.
The best practice really for Tandem 365 and what we've learned about caring for others is that, wouldn't it be great if I could hand you a story about someone that told you the whole story of my life, my development, how I grew up as a child, some of maybe the depression I lived through, and that's what you got to take care of me, versus here's your diagnosis, here's a list of your meds, now figure out what's wrong with me and do a care plan. What we've learned is the care plan's really not that. The care plan is, I need to understand why a person makes the decisions they do. Why do we call them non-compliant? What drives them to make their decisions? And from that, I guarantee you, we can usually find solutions.